My name is Michael Burke, and I am a psychoanalytic, psychodynamic psychotherapist in Manhattan's West Village, New York City. I work with individuals and couples, and as a queer person, I specialize in working with the LGBTQIA+ community. I love the work that I do. I've been doing this for a little over 20 years now. And kind of my formative years in becoming an analytic therapist was after graduate school, when I attended the 2-year psychoanalytic psychotherapy training program at the Psychoanalytic Association of New York. And although I've integrated other models into my practice over the years, particularly for couples, such as the Gottman method or some parts of the Imago method, the foundation of my work is rooted in analytic technique and analytic principles. Before I was in private practice, I did a variety of different jobs in community mental health settings, working with people with HIV, people who are homeless, people with dual diagnosis, substance abuse disorders. So I had quite a bit of other experience before I became a therapist, but this is really what I love to do.
Hi, my name is Dr. Petra Pilgrim, and I'm a psychiatrist as well as a therapist. During the day, I run a residential program for executives and professionals who are struggling with a myriad of things, different diagnoses, depression, anxiety, sometimes a past history of trauma. They stay in my residential program for 4 to 6 weeks, and then are discharged to a different level of care. Thus, psychotherapy and intensive psychotherapy is a huge part of my practice. I moved up here to Connecticut from Houston, Texas, where I was treating veterans with PTSD and co-occurring substance use and personality disorders. Therapy is very meaningful to me, and my career has been focused primarily on psychodynamic psychotherapy.
Hello, my name is Horacio Ochman. I'm a full professor of child and adolescent psychiatry at Brown University and faculty at the Boston Psychoanalytic Institute. I teach different schools of child analysis, and also I teach at Brown to our dear triple boarders psychotherapy. In our psychotherapy clinic. I'm originally from Argentina, from Buenos Aires, which is a very important psychoanalytic country. When I got into medical school, when I was 18, I studied to read Freud in study groups. After my residency, I was very fortunate to go to the APsA clinic in England and study adolescent psychoanalysis and psychiatry. For a few years. The clinic was just around the corner of Freud's museum, so that was my place to think on how I was doing with the training. And also was very near the Anna Freud Center, where I used to go sometimes. The reason why I decided to join APsA was that after my training in psychoanalytic psychotherapy for children and adolescents at APsA, I knew a lot of British psychoanalysis and Latin American, Argentinian, French analysis. French analysis is important in Argentina as well. But I wanted to be an ongoing learner, given the fact that I was living in the United States. I wanted to be an ongoing learner and learn American psychoanalysis, and APsA, not just APsA, but also APsA gave me the opportunity to go to the meetings and listen to the big American psychoanalytic thinkers and listen to their case discussions and panels and papers. And that actually was really very rich for me because I was able to integrate their thinking with my thinking.
My residency program at Baylor College of Medicine in Houston, Texas was psychodynamically focused. And as a result, I learned a great deal about the American Psychoanalytic Association. And my mentors told me about the APsA fellowship program. Because at the time I was flirting with the idea of completing psychoanalytic training, and I wanted more exposure to the organization. I applied and became an APsA fellow about 10 years ago, and that year I had such a wonderful experience that I joined the organization at that time. During that period, APsA psychotherapists who were not psychoanalysts were part of a subgroup called the Psychotherapist Associates. So that is what I joined, and instead of going into psychoanalytic training, I did a psychodynamic psychotherapy fellowship at the Institute in Houston. And I have to say, all of my interactions with APsA from then until now have been extremely positive. And when I first arrived, I was an early career clinician, and I felt as if I had found my clinical and professional home. As a psychiatrist, I of course was a part of the American Psychiatric Association, but I found the American Psychoanalytic Association to be warmer, a more focused group, a group of intellect and excitement around therapy that was different from my experience at the American Psychiatric Association.
The main reason why I decided to join APsA was because I was feeling pretty isolated as a therapist in private practice after years and years. And I just wanted to have a chance to connect with other therapists on a bigger scale. You know, the good thing about having your own private practice is that you get to work for yourself. But the biggest downside is that you're always working alone, you know, without other colleagues, you know, aside from consultations and things like that. So I really thrive on connecting with other colleagues because I'm very extroverted. So I'll often meet colleagues here in New York for coffee or for dinner, just to connect. So when I went to my first APsA conference, I just really loved being in a big group of people. Really helped me feel a lot less isolated. The other big thing that really drew me into APsA were the discussion groups at the conference. I just found them to be very rich and just very full of like great material, and I just learned a lot, not only from the presentations but from the discussions afterwards. And I just loved that kind of lifelong learning aspect of APsA, which is at the core of this is one of the core values of APsA.
Community being the biggest one. I really appreciate being a member of APsA, a full member now. I'm thrilled that psychotherapists are accepted and considered as full APsA members. And it is still the most rewarding organization that I belong to. I appreciate getting to know fellow psychodynamic psychotherapists all across the country. I really enjoy the discussions we have. I think APsA was the first national organization in which I presented my own clinical work, some cases, and I learned a great deal from that experience, and I continue to present at APsA meetings. When I attend an APsA meeting, I am excited, I am challenged by different perspectives. I leave the meeting feeling refreshed. I'm bringing home innovative ideas to improve my psychiatric practice as well as my psychotherapy practice. In addition to the work I do during the day, I have a small psychotherapy practice in the evenings. And though I can also prescribe medication, my focus is of course on therapy. And belonging to APsA has brought such richness to my clinical work. And I'm thrilled and excited for it to continue. And I think this is a new era with psychotherapists being full members. I think we are seen, heard, recognized, and as well as accepted by the psychoanalyst members.
One of the big benefits that I found in being an APsA member is the sense of community that I feel, and the sense of community that I've kind of grown into over the years. As a psychoanalytic psychotherapist, naturally when I started going to the conferences, I gravitated towards the discussion groups and the programs that were geared towards psychoanalytic psychotherapy rather than just psychoanalysis. And I came to know a group of analytic therapists or therapists who were interested in analytic thought over the years at APsA, and eventually led me to join the Psychotherapy Committee, which I'm currently a member of. And with this group of people, I just feel like, oh, these are my people, you know? These are the people that understand the kind of work that I do, and I understand the kind of work that they do. You know, there are a lot of different reasons why most of us decided not to become full-fledged analysts and instead practice psychotherapy from an analytic lens, or just consider ourselves analytic therapists. But we're a specific kind of subgroup, and I just found a really good home in that. And as part of the Psychotherapy Committee, I co-host 2 social events at the annual meeting. The first one is a networking wine and cheese event. It's really fun. And the second one is a dinner that we do outside of the hotel at a restaurant, and both events have been really successful and really fun. It's been great doing that the last couple of years, just to be able to organize it and feel like a part of something bigger. It's a really fun group. We work really hard, but we also know how to have fun.
APsA is a very diverse institution in the sense that when I go to the meetings, I'm not just with psychotherapists, but also with psychoanalysts, and I'm not just with physicians, but also with doctors in psychology, social workers, and educators. That brings the integration of a lot of knowledge, because everybody has a different background, and one can learn from different colleagues and their different clinical experiences. Every time that I come home, I feel that I have been enriched again. Thank you so much for listening to me.